Initially, like when the COVID outbreak happened, and we weren't really seeing much cases in kids. We had a few kids who had very similar symptoms to what we were seeing in the adults, which were mainly the breathing problems that they're having, difficulty breathing, cough, runny nose, congestion, and fevers. But over the past, I would say about 2 to 3 weeks, we actually have been seeing more and more kids who have been coming in, and I kind of are dividing them into two groups. One group is tends to be the younger kids who are maybe generally around like 5 or 6 or so, and less than that. But there's some overlap with older kids, but they tend to have this picture, which we call Kawasaki. It's a condition that's been around for years, but essentially it's a condition of inflammation, meaning that certain blood vessels in the body become inflamed, and so the symptoms are having a red tongue, red eyes, rashes will too, and also having very high fevers. And the other thing too is actually having some peeling of your skin as well too. The other aspect for the older kids that we're seeing, especially some of the teenagers, a lot of them are more presenting with abdominal pain, fever, and diarrhea with some of these rashes and everything as well too. And so these kids actually, it's very interesting because some of them are testing positive for coronavirus. The other group, though, they don't aren't current. When we do our test to see if they have coronavirus at this time, they're testing negative. But there's an antibody test that we use that lets us figure out if they've had coronavirus in the past, and a lot of the kids are testing positive for that. And so for some of these kids, it's we're not 100% sure what's causing them to have these symptoms, but it seems to be related. Inflammation, the body is causing some inflammation in reaction to having coronavirus in the past. And so, this sounds very scary, of course, but I have good news for you all that there's treatment for it actually. So we've been very successful in treating all these kids. There are different medications that we give that reduce the inflammation. And so we've had actually a pretty good success rate. The main reason that I'm a heart physician, actually, I help take care of kids with heart. The reason why I'm involved with this is that for some kids, it's not the majority actually. It's a small percentage of the kids, but inflammation can be so severe that it leads to inflammation of the heart. And so with the inflammation of the heart comes decreases in the blood pressure and other signs actually. The heart's a pump essentially. And so for an example, if I put a gallon of fluid in the heart, we expect a gallon of fluid to come out because the heart's just a pump blood. For some of these kids, actually, just as an example, if there's a lot of inflammation, if I put that same gallon in, maybe only half a gallon or a quarter gallon will come out because there's so much inflammation that the heart can't pump it out. And so for those kids, actually, we've had to do a few things, such as give medications to increase the blood pressure. Some of them we've had to connect to ventilators and everything too to help them breathe as well too. But again, I think the big take-home point, this is a very scary condition, but have been very successful in treating the kids actually. And so the main take point I want to tell the family is that if your kids are having these symptoms where they're having fever, high fever for 2 days or 3 days, or a very diffuse rash as well too, or abdominal pain, nausea, and vomiting, I really want to encourage you to talk to your pediatrician about these symptoms because they can help triage you and tell you whether they need to go to the hospital or if there's something that you can manage at home. I know there's a lot of fear about going to the pediatrician, especially in the time of coronavirus. I can tell you that we really encourage it. Actually, we have a lot of safety mechanisms in place so that if you go to the clinic, we can kind of isolate you from some of the patients that we may have who are exposed to coronavirus.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.